Okay, I've got 90 seconds to talk to you about general anesthesia versus IV sedation for your facelift procedure. Yes. Frequently asked question, you can have a facelift with just IV sedation. Probably most of my patients only have IV sedation. So let's skip to the end, and super important. Are you going to have a better facelift result with one or the other? No, of course not. This is dependent. Your facelift result is dependent on many things. Side note, of course, I have to say your recovery is just as important as the surgery itself, but talk to your surgeon about it. Of course, every surgeon thinks that how they think it should be done is the best way, and that's good because you want your surgeon to be confident, but you do have options, and ask this when you're doing your consultation. I also want to say, I'm trying to talk fast. The main difference in very, very basic terms, general anesthesia, it's just the same as when you're having like gallbladder surgery or your hip replaced. There is an anesthesiologist that is completely in charge of managing your airway. Whereas IV sedation, you're only receiving medication in your IV. And so it's almost like if you've ever had the pleasure of having a colonoscopy, you're kind of in twilight, you're kind of a little bit out of it. It's not scary. My patients sometimes freak out about it and they're like, I wish I hadn't worried. If you experience any pain, you can usually say ouch, and they'll give you a little bit more medicine, and it is not an issue. So both are appropriate. Both you can have a great result. Talk to your surgeon about it. I hope that helps.